The CDC says someone in the United States has a stroke every 40 seconds. Every 3.5 minutes, someone dies of stroke. In today's To Your Well-Being, we're reviewing what we all should know about strokes. It could save your life or that of a loved one. So to help you do that, we have Dr. Ashish Arora with Cone Health Medical Group, and he's giving you all the information that we all need to start. Okay, so first and foremost, let's kind of set the stage here. Some folks think that only older adults, seniors, are the ones who are at risk for strokes.
That's actually not correct. We have been seeing strokes in all age groups, from as young as neonatal period to the elderly people, as you've said. So strokes can happen at any age group to anyone at any time.
Okay, and that is just a scary thought that is something that can happen no matter what. So how are strokes preventable? What steps and things should we be following?
Very good question. So there are certain things that we can't change about ourselves, our genetics, our hereditary things that we inherit from our parents and families. But the things that are under our control are the modifiable risk factors, such as controlling high blood pressure, quitting smoking, exercising regularly. More recently in the pandemic, we've seen association of blood clots that go to the brain and cause strokes with the COVID-19 infection itself. So if you are at high risk for COVID, get vaccinated and prevent yourself from being a victim of one of the complications that we've seen with the pandemic.
Mm-hmm. All right, so are there health issues that people should be aware of that increase their risk of having stroke? I know you had said the blood pressure, but what other things are we looking at?
So the other factors are advanced age, high blood pressure, high cholesterol, atrial fibrillation, which is an abnormal heart rhythm. If you have that, you need to speak with your doctor and your cardiologist to be on adequate blood thinning medications that can prevent your chances of strokes. Smoking, a big no-no and a big risk factor.
All right, and so what would you say to someone who thinks, okay, I think I have a family history of stroke, or I'm at an increased risk. Is there anything or nothing that I can do?
No, there are certain steps that everybody, irrespective of family history, but more so when you have a family history, you should be doing. You should be seeing your doctors regularly. You should follow their advice. You should get your blood tests checked. You should check your cholesterol. You should check your blood pressure. If you have high blood pressure, you should be treating that regularly and adequately under the supervision of your physician.
Okay, so I know that after the break, we're going to talk about the warning signs and what to do if you think someone is having a stroke, that, you know, it could possibly save a life. But is there anything that's just on the generic thing of, okay, we're just talking about strokes? And once again, I think we should reiterate that it can happen to any age group.
That is correct. You should be looking for signs of any sudden change that can happen in a person. And we'll talk about that later when we talk about the be fast. Any sudden change in neurological function should raise a suspicion for a stroke.
Okay, and so when you said we need to be seeing our doctor, especially if we have that predisposition, we need them to do the full blood work every single year.
Correct. And based on your risk factors, they might suggest you medicines. They might suggest that you only change your lifestyle and have exercise introduced more, change your diet and other lifestyle modifications. So it would be very specific to specific people. And that is why your doctor is going to be your best friend in determining your risks and preventing strokes in you in particular.
Mm-hmm. And this is one of those things where a lot of times, because of COVID, people just didn't get to see their doctor.
That is correct. And we are making all efforts here in our system and all the health systems nationwide so that we can provide access to our patients, whether in person or through telemedicine, to be able to get them to see their doctors in a more timely manner.
All right, so maybe we've been putting it off, or we weren't able to get the appointments and things of that nature, so we're urging you to get those preventative appointments made. All right, we're going to take a quick break and we will be right back. And we are back with Dr. Ashish Arora. He's talking about strokes and what you need to know and how to handle them. So let's go over what are the signs that we should all know that may indicate that someone is having a stroke.
So the quick mnemonic to remember for strokes is be fast. B as in balance. If you suddenly become imbalanced, dizzy, or you cannot walk in a straight line. E is for eyes. If you see someone or yourself, you feel that you can't see towards one side of your visual field, or your eyes are gazing to one side without being able to come to the middle, that's for eyes. F is for face. It's for face drooping or facial weakness. You might see the face being drawn on one side. A is for arms. If you have a person who you suspect of having a stroke, stretch their arms up and one arm goes down, that is for arms. S is for speech, whether the speech suddenly became slurred or incomprehensible, or if you feel that the person has just started speaking gibberish or garbled when they were absolutely talking normally a few seconds, few minutes, or even few hours ago. Then T is for time to call 911. That's the mnemonic that you all should be aware of at all given times, whether you're in a supermarket, whether you're home, whether you're visiting someone, whether you're stopped at a rest stop. You should always keep that in mind.
So with that be fast, do they have to exhibit all of these things, or if they exhibit any of these things?
Either one of them could be a sign of a stroke, or a combination, or all of them. Some people might just have one or two or three or all of them. So any of those should raise a red flag. Any one of those symptoms present should make you suspicious for a stroke.
Okay, and so this is one of those things where you don't want to wait. I know that a lot of people want to put their loved one in the car and drive them to the hospital because they want something to happen very quickly. Why shouldn't you drive someone to the hospital who you think is having a stroke?
That is a very good question. So every single patient who's having a stroke, we know based on our studies from these patients that every second that a person is experiencing a stroke, that the brain is not getting the blood supply it needs, it loses 30,000 brain cells. Over the whole duration of one stroke, a patient's brain can age multiple decades. A 60-year-old person having a full-blown large stroke can come out with it with a brain that looks like an 80-year-old person. So they've lost 20 years worth of functioning. And that's why it's very important that you call 911. The EM professionals, the emergency medical professionals of every county are well trained in picking up the symptoms and then making a decision as to where they should be transporting you, because time is brain. Every second matters. And they know the shortest routes, the quickest ways to get you to the center where you can get the treatment fast. Once again, remember, time is brain. You might think that you're doing a loved one a favor by putting them in the car and driving them, but the time that it takes for you to load them in the car, drive through a traffic jam, come to an emergency department, get registered, and the time that someone takes to see them and finally identifies that they're having a stroke, you've probably lost 10, 20, 30, 40 minutes. That's crucial brain activity, and that's crucial brain power that's being lost at that time.
Okay, so call 911. Do not, there's no mistaking about that because time is of the essence. All right, what final messages do we have about stroke that you want us to all know?
So I want everybody to remember the mnemonic, be fast. Balance, eyes, face, arm, speech. Any of them is wrong, T, time to call 911. I want all of you to make sure that you're seeing your physicians regularly. Everybody, even those patients or those people who think that they're very healthy and maintain a healthy lifestyle, you should be getting your annual physicals. If there are any things that need follow-up, please do follow up with your physicians. A lot of us, including us medical professionals, are guilty of putting off our appointments and not seeing our primary care doctors. Please do not do that. Please go see your primary care doctors. Please see your specialists, cardiologists, and other specialists as given recommendations for. If you smoke, please quit smoking. That's one of the biggest modifiable risk factors that can reduce your chances of having a stroke. If you have high cholesterol, discuss with your doctors about getting that to a goal normal level that will reduce your chances of strokes. If you have atrial fibrillation, make sure you are in touch with your primary care and your cardiologist to determine what are the best options, surgical and medical, to prevent strokes. I know I crammed up too much in this, but remember all of these are very, very helpful things.
Yeah, and the main thing is go see that doctor. Get that started, get that going so that you can get a treatment plan going if this is pertaining to you. Thank you so much for your time. We so appreciate you. All of this is going to be in the To Your Wellbeing section of your website. It may be something you need to watch again or something that you show to a loved one.